everyone, and welcome to week 13. Today we will be discussing assessing and evaluating organizational effectiveness. So I should have received everyone's community assessment papers by now. We are wrapping up, just a few more weeks left of the semester, so hopefully everyone is feeling good. Let's see, we're going to skip that slide. So when we're thinking about organizations, the lecture for this week is taken from chapter 8 of our main textbook. So when we're thinking about assessing organizations, the two things we need to assess are the organization's environment, the feel for the organization, and then the internal structure of the organization. So when we're thinking about the organization's environment, I've touched on some of this throughout the past few weeks. So organizational environment, again, is kind of looking at their revenue sources, so making sure that the organization isn't, they don't rely upon only money from the United Way or only money from one revenue source, that they have diversity in revenue sources. So they might be receiving a third of their money from grants, a third from special events, a third from program fees, so that they don't have all their eggs in one basket, because that really puts them at risk if something might change to that funding source. Maybe the United Way is not going to fund them anymore, but yet they were relying 100% on them. So they need to be, really diversifying their funds. The other, again, is looking at their relationship with collaborators, competitors. I talked about this last week when we were looking at the external environment. So this is kind of looking at who are they competing with for contracts, for donations, for volunteers, for clients. There's a lot of similar organizations out there, but different organizations do different things. So it's really being able to position yourself in a way that makes you unique from other organizations. The nonprofit that I work at works with kids with disabilities. There's a lot of nonprofits in St. Louis that work with kids with disabilities. There's a lot of other recreation providers. So there's other organizations that do very specific things that are similar to the organization I work for. So it's our responsibility as an organization to be aware of who we're competing with, because the fact of the matter is that we are kind of competing with other organizations and trying to get grants. There's very specific funding sources, specific foundations that might want to fund organizations that work with kids with disabilities. So we do need to be aware of who are the other organizations that might be applying to this foundation. And how can we position ourselves in a way that is unique from those other organizations. It's also important that, along with having diverse revenue sources, that we have diverse providers and services. So if we think about diverse providers, so it's important that our providers look like our clients with regards to, specifically if we think about like gender and race, sometimes for age, but if we're working with kids, that doesn't mean that our providers should be children as well. So it's important that, if we're working in foster care case management, if we're working predominantly with families who are Caucasian, that our providers might have a similar racial background as our clients. So we might have more Caucasian providers in that area. If we are working in another area for foster care case management, another location that has primarily African American families, maybe we have some more African American providers in that area. Or that we have a mix of the two, that we have females and males similar levels. It doesn't mean that we always have to have females working with females, but if we're working with mostly moms, we should probably have a lot of female providers and not all male providers. So we need to have some balance between the two. Also, think about diversity with regards to your board of directors. I work for an organization that works with kids with disabilities, so it's important that we have membership on the board of directors that is able to account for disabilities. So we kind of check that box by having some parents who have kids with disabilities, but I think it would also strengthen the organization by having maybe an adult with a disability on our board of directors as well, and really being able to weigh in on the organization's procedures, because it's important, again, that we're able to have strong relationships with our with our clients, and we're able to maintain that and really able to keep the ear on the ground by having people in leadership roles who really understand that population. We always want to make sure that we're putting the population first and that we're making decisions that are in line with that, and it's important that we have people who represent them. So again, looking at the client characteristics, the selection of our clients, and clients' access to the organization. So this is also things we need to keep in mind. So if we're thinking about client access to the organization, so let's think about clients' physical access. So do we have barriers that are preventing the clients from just getting to the organization? So barriers could be in transportation. The organization I worked for previously worked primarily with families who lived in North St. Louis County, but our office was located in South St. Louis County, and these families had very limited transportation. That made it really tough for them to get there, so it kind of required the staff to drive to them because the clients weren't able to get to us. So it's important that our building and our staff are located in areas that people are going to be able to get to them. You can also think of access with regards to, again, to abilities. Are there physical barriers? Are people with disabilities able to access the building? Is it handicap accessible? If we're thinking about the characteristics and the selection of the clients, depending on the organization that you work for, people choose which clients are going to get placed into the program in different ways. So it's important that we are assessing, what's our intake strategy. Different organizations have different strategies. Where I work, currently I work with kids with disabilities in a recreation environment. For me, when we're deciding, when it's someone's turn to come off the waiting list and being enrolled into a program, it's a first come, first serve process. So I don't look at anything. All I look at is the application date, and I look at which programs they want to be enrolled in and if there's a spot for them. However, an organization I worked with previously, when they decided if a family is going to be enrolled in the program, they had a long waiting list. So they really considered a lot of details about the family before they were going to decide if they were going to enroll the family. And what I found is that they did a lot of creaming. So I'm sure that organizations you guys might work at do some of this as well. So creaming is the idea that you're going to take the best clients, the clients who have the most likelihood of success, and those are going to be the first clients who you're going to be providing services to. Is that ethical? Maybe, maybe not. You can only provide services to so many. When you cream clients, that is going to make your outcomes look better, but it doesn't always ensure that you're kind of providing services to the clients who need services the most. So what I found is an organization I worked at previously, what happened was when we had a waiting list, we didn't always have a waiting list. So when we had a waiting list and we had a limited number of people we could take in, we would enroll clients who had less risk factors. We would enroll clients who, again, were kind of, they tended to have higher income. The parents were typically working, they had less mental health issues. So this was all taken into account when we were just selecting clients for the program. However, a few months later, let's say that we no longer have a waiting list. In fact, we've had a lot of families drop out of the program. So now we're looking for families to enroll. Now we're probably going to accept anyone. We're going to not look at those risk factors. We're going to accept lower paying clients, families who might have more mental health issues, more homeless issues. So it just really depended on the time of day, the time of month, as to whether a client was going to get enrolled or not. It was not a very set in stone process when we looked at how we were going to select clients. And that was really troubling to me as a social worker, that we did not have very set procedures in place as to whether someone was going to be enrolled into the program. it's different people have different ways. So I know that for some of you who maybe you're working at a substance abuse treatment facility, you have limited beds. How do you decide who's going to get that bed? Is it going to be the person who is, most needy, the person who has the highest risk for substance use? Or is it going to be the person who has the lowest risk, who needs the services but has the lowest risk? You really have to balance the pros and the cons, because it might be the person who has the highest risk. If they kind of take this bed, they're also at the highest risk of not completing treatment. So maybe you're going to find some people in the middle who are at risk but might still be successful. So you kind of have to weigh the pros and the cons when you have limited services, because most, substance use, homeless services, you have to really decide you might be deciding who will be the most successful in the program, and gear the programs through that. Other ways that you can cream clients, some people only accept people who have private insurance. Not all organizations accept Medicaid or Medicare clients. That's one way that you're going to cream them, based on their income. That's kind of determining based on the income if you're going to allow them in. But a lot of that, again, is determined on how much space you have in the program. Because if you have limited space, you have to find a way to really select clients in an ethical manner. Okay, so just some additional information when we're thinking about assessing the relationships between our clients and our referral sources. We have to have a good relationship with with the other organizations that we work for. So when you think about, depending on if you work at a substance abuse treatment facility, if you work at a homeless provider, you have other social service workers in the area who are kind of referring clients to you. So it's important that they kind of understand the population and how many areas you have open. So this is taken from the book. So think about your client population. So maybe your client population are drug users. Think about your supply and demand. So how much space you have versus the demand for it. So you might have a 3-month waiting list. Who typically is underserved? So in drug users, probably people who are uninsured or not able to pay for the treatment, versus substance users who have private insurance are probably going to be the first ones that are taken. If we think about foster kids who are in foster care, there's probably, let's say there's 1.5 children for every home available. So kids are going to have to wait for services, and kids who are most underserved are going to be kids who have special needs because it's more difficult to place them. So all of these need to be taken into consideration when we're thinking about our clients and how we're able to take them in. So when we're thinking about an organization internally, so when we think about those internal structures of the organization, part of what we need to think about is first the corporate authority and the mission. So this is a fancy way of saying, what's the legal structure? So is this a public organization, a private organization, or a nonprofit? Okay, so public organization is one that is going to be run by the government. Private is going to be like a standard business, private business, who's trying to make money. Nonprofit is structured legally in a different way. So the goal of the organization, again, I talked about this before, is not to make money. So they use any profits that they have and reinvest it into furthering the mission. So it's important that we understand the legal structure. Then we need to understand the program structure, the managerial styles of the people in charge. So what's the program structure? So these are all of the activities we're doing to carry out the mission. And if we don't have good structures and managerial styles in place, we're not going to be effectively carrying out the mission. So you can read a mission statement of an organization and fall in love with it. But if you don't have these structures in place, that organization probably isn't actually having any impact. So it's important that we understand these program structures. So this might be, do they have rigid, flexible structure? What's the communication styles? Do everyone have to go through their direct supervisor? One organization I worked at, I wasn't able to talk to, I couldn't go straight to the executive director. I had to go to my boss, who then talked to her boss, who then talked to the executive director. It was very funneled in a way that we had to talk directly to our supervisor. It was very much a top-down approach. So people at the bottom didn't get a lot of input, and that was their managerial style, or at least the managerial style of my manager. And it didn't work well for me. I really felt out of touch with the higher organization. But sometimes that's the approach you have to have in a larger organization. That's the structure that needs to be put in place. There's also accountability measures. So we're going to go through accountability measures later, but organizations need to have really structures in place that ensure the accountability of the staff. So accountability of staff can be both staff time and the way money is being spent. So how is staff spending these limited resources, and also how is staff using their time? Staff need to be held accountable. So there's different ways you can hold staff accountable. We'll go through some of them next week. But part of the ways we can think about accountability could be efficiency. So thinking about how money is being spent. Is it being spent in the best way possible? So a lot of times organizations look, or like when the United Way is evaluating an organization, they'll look at how much money is being spent directly on program expenses versus fundraising. So that's one accountability measure to look at the proper use of funds. Other accountability measures are looking at the effectiveness of the organization, so looking at client outcomes, the impact of the organization. If they're spending, $1 million, what percent of, let's say this is a foster care case management organization. If they're spending $1 million, are they being effective in making sure that kids have good reunification with their parents? What's the reunification rate? Those are different types of accountability measures to look at the effectiveness of the organization. We should also be looking at the technical resources of the organization. So technical resources could be the budgeting process. What's the experience of the staff who are doing the budgets? Does the chief financial officer have an accounting background, or do they not have an accounting background, or is there a bachelor's in history, or what's their experience that really will ensure that they're able to best use the funds and have a good background? Facilities, equipment, IT, does the organization have good IT systems in place? I'm sure anyone who works in social services has to use some sort of database for inputting client information. We all hate the database, but we have to use it. And it's important that we have good databases that are going to be well functioning so that we're able to pull the information that we need in the most effective way possible. If we have email problems, do we have an IT person? The organization I work at right now is super small. We don't really have a go-to IT person. Our financial guy is also kind of our IT person, which becomes problematic because he doesn't know how to do everything. Of course, he's only one person. He can't do a million things. But when you are working at smaller organizations, it's harder to find someone to fill every single role. You don't always have someone who has an expertise in marketing or an expertise in IT. So it's important that we're really evaluating what resources the organization has available. Also thinking about, office space, the location of the office, but think about space. If you're trying to do, if you are providing counseling, if you're a counseling organization and you're providing one-on-one counseling, do you have physically the space for staff to provide counseling? Organization I worked at previously provided a lot of counseling services, but staff, they didn't have enough office space for staff. So staff were, their staff offices were shared. So they would have like 3 staff in one office, and then they had a few counseling rooms that staff could then book for their one-on-one counseling sessions. But what happens if you have, more staff providing counseling at 10 a.m. on a Friday than you have rooms available? That becomes problematic, and it really doesn't help the organization fulfill its mission if they don't have proper facilities in place. So that all needs to be taken into consideration. So these are different ways that we can assess the corporate mission statement. So these are questions you should be asking. Do they have articles of incorporation? So articles of incorporation would be for like a private nonprofit or a private or a nonprofit, they have to incorporate, that's some fancy business terms, but they have to incorporate with the government to say we are an established organization. So they need to have articles of incorporation. Do they have bylaws? So these are kind of procedures in place for maybe bringing on a new board member or getting rid of an executive director, things that they need to be agreeing upon. Are the board members familiar with the bylaws? Does the organization have a mission statement? Is it short? Does it discuss client outcomes? And are the staff aware of the mission statement? So these are kind of some checklists for assessing the corporate mission statement. The most important thing to keep in mind is when we're evaluating an organization, it all starts with the mission statement. Look at the mission statement of the organization. I would highly suggest this. If you work in a nonprofit or volunteer there, go back to their mission statement. Does it clearly articulate who they're serving, what they're trying to do, what the impact they want to see? These are all things that should be included in a mission statement: the cause, the action, and the result. And it's all really around the impact. And everything the organization is doing, all the activities they're doing, should be centered around that mission, or else you're starting to have what's called mission drift. So if you're an organization that serves kids, if you start serving adults, is that going to be still in line with your mission? If your mission specifically says to help youth with disabilities and you start serving adults, that's considered mission drift. So that's pulling away. If you have kids in the name of your organization and you're serving adults, that's drifting away from what you were established to do. So we can take our mission statement and then be able to evaluate the organization from there. There's different ways to evaluate the organization. So this is called our family of measures. So there's different measures that the organization should have in place to identify if they're carrying out their mission. So the different measures might include impact measures. So again, the organization will have different they have a mission. They have an overall mission statement. And from their overall mission statement, they probably have a vision statement, which is a little longer. But from their mission statement, they're going to have specific goals in place, okay? So along with this overarching impact, we have very specific goals we want to reach. And in order to reach those goals, we're going to have to engage in strategies or tactics, very specific activities to fulfill those goals, to then fulfill the mission statement. So if you think about a logic model that we talked about earlier in the semester, this kind of goes right along with that logic model. So the idea that you have this long-term, what do we want to solve in the long term? From there, we have to have more specific, like what do we want to do this year versus what do we want to do next year? So an impact measure is in the long term, what do we want to solve? So, if we're thinking about a substance abuse agency, in the long term, we want to end substance abuse. That's our overall mission, is to end substance abuse. End substance abuse. Overall mission, that's the impact we want to have. Our goals from there might be that we want to see reduce substance use amongst so many people. That's one of our goals, is we want to see reduced substance use, because reducing substance use will then lead us towards our mission of ending substance use. The specific activities we might have in place would then be that we serve 150 people this year by providing them with a 10-week drug treatment program. So again, if we're thinking about our impact measures, that's our overall reaching goal. So overall objective of the organization. What impact do we want to have? Our activities would be, what are we specifically implementing? What are the programs we're implementing to fulfill our goals? Our capacity is just looking at those outputs. So what specifically did we do? So let's think about parenting classes. So I used to lead some parenting classes on proper discipline. So my overall impact was to reduce the number of kids who were abused, okay? So I was providing parenting classes, and by providing these parenting classes, I had my overarching goal of reducing the number of kids impacted. I could then look at my activity measures. So by providing these parenting classes, I was able to change parents' knowledge and beliefs. So what was the goal of that activity? By changing parent knowledge and beliefs, I can then solve the impact. The capacity measures is looking at the specific numbers. So how many people did you serve? So I served, 100 families. I provided parenting classes to 100 parents by providing parents with 100, by providing parenting classes to 100 parents. I met my activity measure of changing, 90% of parents learned, kind of changed their beliefs about using spanking as a discipline, using these more corporal punishment measures. By changing parent beliefs, I then was able to reduce the number of kids who were reporting maltreatment. So these are the measures we need to have in place. So it's not just looking at these long-term measures. We need to understand how our day-to-day activities are fulfilling our mission. Okay, so it's of course important that we are able to measure impact. So how do we measure impact? So those are some specific measures, but of course it all goes back to the mission statement. So it's really important that we have a mission statement that we are able to quantify, so that our mission statement is to reduce child maltreatment, we can quantify that, because we know we have measures from Child Protective Services of the number of kids who were hotlined for child abuse for each county in Missouri. So we're able to see our mission statement quantified. If we are a substance abuse treatment facility, maybe we can, our mission is to reduce substance use or to reduce opiate deaths. We can look at hospital records to see the number of people who overdosed. We have a very quantifiable mission statement, something that we can put into numbers. So it's important that we are utilizing research to show how our methods work, and that we have very specific goals in place that can then show how we're fulfilling our mission statement on a larger level. So let's think about some very specific nonprofits. Read the mission statement and see, does the mission statement have a very quantifiable impact? This is Goodwill. So this is a national organization. So the Goodwill works to enhance the dignity and quality of life of individuals. You can read this, helping people to reach their full potential through learning and the power of work. So their emphasis is on work. Okay, so what I pulled from their website is their impact, that they had placed more than 312,000 people into employment. So they have a mission statement that's kind of broad, but they're able to quantify this mission statement through this impact statement, the specific number of people that they had placed into employment. Okay, we can also look at another organization, the Council for the Prevention of Child Abuse and Neglect. So their overall mission is to educate and strengthen our community to prevent child abuse and neglect. So their mission is specifically focused on education. So their impact is then the number of people they were able to train. So they were able to train over 1,150 people to recognize and report child abuse. So because their mission is specifically on education, that's a good impact measure. If their goal, so read their mission statement, to educate the community to prevent child abuse. They could also look at child abuse numbers, but because of how they identified their mission statement, they can really focus on that education component. Here's another example from Toledo. So Task of Northwest Ohio, their mission is to break the cycle of recidivism by helping individuals become healthy, self-sufficient, law-abiding citizens. So to break the cycle of recidivism is very quantifiable. So they were able to say that over 86% of offenders who completed their services remained in the community without arrest for at least 1 year. So it's a very specific, quantifiable mission statement that they can show the impact statement for. I would highly suggest that you do this for your nonprofit that you work at. Okay, so activities for the week. So what I want you to do is to read through the mission statement for the St. Louis Arc. I posted it online. Read their mission statement and then read their annual report, and kind of in half a page to a page, this can be short. Tell me, is their mission statement quantifiable? Does their mission statement directly align with what they are kind of stating as their impacts? So their annual report on the second page does a nice job of kind of outlining their impacts. Are those impacts directly related to their mission statement? And is the mission statement quantifiable? So is there a connection between the impact, their stated impact, and their mission? We do not have a lecture quiz this week. You're welcome. Our last lecture quiz will be week 14. Okay, so what's on the horizon? We are so close to the end of the semester. We have one major assignment left. It is the nonprofit assessment presentation. So it's going to be due on May 10th. So as part of this, students will conduct interviews. So students are going to pick a social service organization. From the organization, they're going to obtain various agency documents, and they're going to need to conduct interviews. So they're going to need to interview at minimum one staff member, and I do want the name of the staff member who you talk to, because I want to make sure that you're not just making stuff up and pulling stuff off the website. So I will need the name and the contact information for the staff member that you interviewed. So I chose to make this presentation not to stress people out, but to make it more low key. So I didn't feel like I feel like writing a paper takes a lot more effort, rather than just kind of talking through the information that you collected. So that's why I chose to make this presentation. I do understand that kind of the online nature of this course makes a presentation a little trickier, but I'm hoping we can work something out. So the description for the organizational assessment is on Blackboard. So you need to submit this or work with me on submitting this sometime the week of May 4th to the 10th. So you have about 2 weeks left. So this is the final thing for the semester. So essentially what you're going to be doing is taking everything we've kind of learned in this back half of the semester to assess the structures of a very specific social service organization. So what you're going to be doing is you're going to, get information from the website, from organizational documents. You can look at professional literature on what our best practices. You're going to you need to interview someone at this nonprofit. And it's going to be roughly a 15-minute video presentation. So there's a few ways, because I know some people might be stressed at the idea of doing this video presentation. There's a few ways that you can do the video presentation. Again, the goal of this is that it's low-key, stress-free. You're able to walk through this organizational assessment without having to write another paper, because we've done a lot of writing in this class. So you can everyone needs to make a PowerPoint presentation. That is a requirement. I need a PowerPoint presentation. You can add, voice to it, kind of like I do on a weekly basis, using Tegrity, Fuse, other video maker that you might have. Tegrity is pretty easy to use. It's built into Blackboard. So if you go to Blackboard, I assume that everyone has access to this. If I'm in my Blackboard, here's our class. On the side, we have Tegrity classes. So if you click on that, it will bring you to this page. All you have to do is click start a recording. And when it starts, you'll see this bar at the bottom. I assume you can see that. I can see it on my screen. When it starts, it essentially records your voice if you have a built-in microphone, and whatever is up on your screen is what's going to show on the video. So you might want to practice that a bit. For people who might not be comfortable with using Tegrity, or Fuse is another option if you've used that for class. Another option is we can set something up. If you are on campus, we can, set up an in-person presentation. I'm happy to do that sometime that week of May 4th to the 10th. We can for those of you not in St. Louis, we can also do Skype or Zoom. Both are both super easy ways that we can kind of do them in person. So you don't have to record something. That stresses off of you. We can do it over the phone. You can email me your presentation and we can kind of walk through it over the phone. I'm happy to do that. The main thing is that somehow I need a PowerPoint presentation in your voice, whether that be built into the presentation, you can send me the video, or we set up a time either in person or over the phone or in a video call, and we can certainly make that work. Zoom is really easy, and you can share your screen. There's a lot of options. So we'll find an option. What I just need to know is which option you're going to go with. Don't wait till the last minute because you have to interview someone for this. So go ahead, find someone now. So essentially you're going to pick an organization, a social service organization. What I will say is, for those of you who do not have immediate access to a social service organization, please get in touch with me and I can provide you contact information. Some of you work at social service organizations. Some of you work in nonprofits or public organizations. That's fine. If you work at one, please feel free to use your employer. That is super easy. If you're not a volunteer or don't have easy access to a staff member who's going to really be able to provide you with some solid information, maybe don't choose someone who just started working there a week before. Choose someone who's been there a little while, who's going to be able to give you some good details. Reach out to me. I have access to many nonprofits in St. Louis, and I'm happy to get you in touch with a staff member. And it won't be random. I'll email them and they'll be on board, I promise. So you need to get in touch with me at least a week before this is due. If you don't get in touch with me a week before this is due, I'm not going to get you in touch with someone. You're on your own. So if you need contact to someone at a social service organization, please contact me at least a week before this is due. So this is due the week of May 4th to the 10th. So May 4th is in 2 weeks from today, which is Friday the 20th. So that means it's due on the 10th, that's a Thursday, May 10th. So that means if you need access to someone at a social service agency, please contact me by May 3rd. So what you're going to be doing in your presentation, essentially have you can have one slide per bullet point or however you want to do it, but look at the organizational structure and environment. So a lot of this is stuff we've talked about the past few weeks. The type of organization, their mission statement, their structure, funding sources, how they evaluate staff and programs, the culture of the organization, assess the agency through the experience of the client. So, their accessibility, their hours, the agency's capacity, their intake, other organizational practices. And then I want a slide on the strengths of the organization and the limitations of the organization. So based on what we've talked about this semester, what are some specific recommendations you would give to this agency that they need to fix? What challenges do you foresee them encountering in the future? So this is outlined, it's on Blackboard. Look it up, read about it, and try to identify someone now. As always, email me with questions. I'm happy to help. And please email me depending on if you need contact to someone at a social service agency or if you need to set up an appointment via Skype or phone call or in person. I'm happy to do any of those. Okay, thank you all. Have a good week.